Hi, everyone. Welcome back to Talking Team CBT. And today we have Dr. Keren Shemesh. I said it okay in the pre-interview, and then now I got nervous on the recording. He's a clinical psychologist and cognitive behavior therapy specialist. And you and I met in Tuesday group, which was really cool, under Dr. David Byrne. Welcome, Keren.
Yeah, thank you, Angela. Thank you for having me.
Well, the first question we always ask is, how did you get into team?
It's probably the most interesting question to hear how people got into team. And I don't know if I have a most amazing story. I've been probably exposed to team multiple times before. But there was a time in my life in the summer of 2018 that I'm like, I think it's time to take it to the next level. I read about it, never used it. And I was just searching for team training, and I came across David's training in Canada. And I live in California, and I'm like, well, maybe there's something closer. So I just kept looking, and I found out that in 2 months in the summer, I was going to do an intensive in San Francisco. So sure enough, I signed up. I attended the intensive, and I can't say that I was bought in right away. I was just intrigued because I found it very complex and sophisticated. I tend to think of CBT as a kind of a manualized treatment that, anyone with basic skills can open the CBT book and employ the skills and the steps and use it. TEAM-CBT had a level of sophistication to it that I felt that it could not just do it from a manual. I needed training in it. So I started attending a Tuesday group, and I started attending a bunch of other trainings, and that's just how it all started.
I think that's cool, and I'm trying to think if that's even unique to so far in our interviews. People have had these like run-ins, but I think there's been a couple people like you who've dabbled just a little bit. Like there's some things that were intriguing, but the buy-in took some time, and definitely we've heard that from different clinicians. And for our listeners, hopefully that this will be one of those tidbits that maybe someday they'll buy in because they're hearing some interesting things. What about it kept you coming back instead of just, like sometimes we hear some theories and we go, we never really think about them again. What about team? It kept you coming back, kind of intrigued you?
I think it's just being part of the Tuesday group, and every week you learn something new, but you also get to practice it. It's not just like go learn about this and figure it out or do it on your own or use it with your clients. It's just like learn it, practice it, use it with your clients, and come back and tell us how it worked. And it was just the fact that it always worked. I think
Okay.
that's what
It
got
was
me back. It
successful.
always worked. Yeah, that interventions are pretty. That I think they do take practice. I think they can be difficult to just like read about it and go and do it. But once you use it and you use it pretty accurately, then you get pretty good results, and that's very, very encouraging to see your clients doing better. You come back with a flavor for more. Like I want more of this awesome tools and techniques and strategies to help my clients.
Yeah, I mean, that's what's works for me, is that it's when you see it working, it's like, okay, that this is the right thing. And then I think for me it's the analytical part. Like I needed the structure just because the way my brain works, that without that I would kind of be pretty lost, being ADHD and whatnot. So those were kind of
I
things.
agree. I think that it also gives me a lot more confidence as a therapist because I have like more clarity what to do in each given situation to help a person. So I totally relate to the structure helps.
Yeah, but it also does, like you said, adds a layer of complexity. And I do have some clients that want to understand everything about team, and they're actually getting a little overwhelmed because they want to learn it as best as a clinician before even putting into practice. And so sometimes you have to take a step back and say, listen, let's just try a couple of these out. Let's try them on, and then I'm happy to teach you more. But before getting too overwhelmed, because I think there is the nuances of anything's worth doing. It does have a side effect, right? There's kind of that point about some of the things like, some of the fake news and fake medications out there, it's because they're not fake medications. I'm thinking of like, snake oil salesmen, right? Like if it doesn't have any side effects, there's probably a reason for that, and maybe it's not as effective. And I think it's true with really powerful tools. They have to take some work. Well, what is something that's improved in your practice having learned TEAM?
I think the therapist improved. I think that really shifted everything. I think that it's, I found with a much more clarity in my approach to my clients' needs. And so if I know that someone comes to me with certain issues, I know exactly what to prescribe them with. And then, I would offer that to them and see if they're interested in this particular type of treatment. And I think that's another thing that kind of really helps me communicate to the clients early on. This is how I can help you. Not only, oh, I can help you, but this is how I can help you. And it gives the client a bit of a sense of like, okay, I think it's supposed to, in my opinion, also empower the client, because I want it to be a collaborative work. I want them to know that without, I have like wonderful tools, but without your cooperation, I'm not going to be able to get much traction. And so I think it could be empowering for a client to be kind of invited in that way, and to bring him in as a partner for that journey, versus let me tell you what to do, or like taking too much responsibility, feeling like I need to fix them, and it's not fair for me or for them, because it's really a collaborative work, as I said. And so I think I changed in so many ways, in understanding and how to bring the client to be part of it, but also in understanding what would work for different type of situations and different type of clients. I'm just trying to think of to respond to it without getting into too many details, or
well, I mean, an example would be awesome. Yeah, I know in TEAM we love getting specific. So if you want to give a specific detail or example, that'd be great.
Oh, you got me now, because I'm also always thinking like client's privacy. I'm not sure
you can make up. Yeah, you can always
share a whole lot.
Or combining.
Let me see. I think of a specific situation. I was still in the early phases of TEAM, and we were doing the cost benefit analysis, and was working with a client who was just, they were a college student, and they really, really struggled with procrastination. And I think that for many sessions, it was just trying to motivate them to do the work. But once I kind of stopped motivating them and just went through the cost benefit analysis with them, they had an aha moment, and they could barely wait for the call to end so they can go and do their work for school. And I remember that the entire session, I did not try to problem solve or persuade them to do the work or anything, but they did all the work. But they were at a point where they were willing to do it and willing to look at it. And so I think this is kind of like a big example of what changed for me, is that I was not trying to help. I was not trying to problem solve. I was kind of really practical. Let's look at the advantages and disadvantages of your behavior. And it was just such an eye-opening for the client, and it really, really shifted for them for the rest of the semester, I think, maybe even longer.
That having that resistance piece, right? The A of agenda setting, or assessment of resistance, but the cost benefit analysis to tap into motivation. So we're not dragging clients along, which is exhausting. Although it can be, it's a bit addictive. I definitely have fallen into the helping habit problem. And even I think last week the client was asking a lot of advice, and I started getting into training mode, because I do a lot of training, and sometimes I kind of slip, I'm like, I'm started treating this client more like a clinician instead of a client. And then when I looked at the ETS scores, the evaluation of therapy scores, I realized my empathy had fallen, even though they were like telling me they just loved the advice verbally out, in the session. So I think it's really that helping piece of being able to just sit back and not do the helping is really profound. And I find that really challenging. How do you not help? Like, what are some things you do to not help?
Um, I think failing is good. It's a good reminder that helping doesn't help.
Mm.
And so I sometimes, it's a bit of kind of counterintuitive not to help other people, right? You really want to help, it's just
Yeah.
kind of fuck it. But I know how. Like, how could I not help them? I do take the bait every now and then, and I fail.
Mm-hmm.
And I just go and correct it the following session. Like, I realized that was trying to help you, or I'm just kind of making it as a mental note and just like, let's start again. And I'm holding back. It's like, you're not helping. If you're going to do this, you're not going to help. You just hold back.
Well, maybe tell our listeners and viewers, how has TEAM affected you personally? You mentioned professionally, it actually changed you as a therapist. How has it affected you personally?
I think a lot. I think I think it was a really missing piece in my life without knowing that it was missing. I think that I was always, yeah, I care to meditate, and I care to kind of maintain balance and have compassion for other people. And I don't, really honest, it's kind of hard to admit it, but it's true. I don't think I had clear understanding of what empathy is, and how to empathize. And I think that empathy is so many things, that not just only in the way we understand how other people are feeling and hold that space for the other person to feel that, and kind of validating, give them permission to feel that.
Mhm.
But it kind of goes back to what we talked about a minute ago, which is like, not helping sometimes could be an act of empathy, right? Because if I'm helping, I'm actually not helping. And it's something that I do a lot in my practice. I work a lot with parents, and I work a lot with teenagers and children, actually. And I always work with the parents as well. And that issue of like helping your child keep coming up, and parents just keep coming back to me, just like, well, the child did not respond well to XYZ. And then kind of really explore that, and we look like, you're problem solving. And every time you problem solve, you are really robbing your child from the opportunity to learn that skill on their own. And that's why they're pushing back. Kind of really need to let them problem solve, because that's really good for their development. And they're not going to problem solve like you. You're not going to have a resolution to the problem of a 40-year-old person. They're going to have a teenager solution, and that might be appropriate for their development, for their trial and error. And so, kind of something that I do, just encourage people to do that with a great sense of empathy. I mean, we need to fail in order to learn, um, and and we are so scared of that because we don't want to be judged, and we don't want to judge ourselves. And I think that's a big thing, like that, understanding that for me, compassion and empathy is just such a vast thing. It can be such a big part of our lives as human beings, and as partners, as family members. And that changed me a lot. I think it definitely softened my personality, and probably a much better listener. I don't know if my husband would agree with that. But he's better. He's definitely better in the 5 secrets. But I'm in work in progress.
Yeah, I mean, that speaks to even your influence, though. If your husband's good at the 5 secrets as well, right? Like there's an ebb and flow within a relationship, and I think empathy was something I was really terrified of. Coming in, being ADHD, being on the spectrum, being a total left brain, and coming into the right brain world. I know those are arbitrary labels, but having those 5 secrets of effective communication to rely on has been a game changer for so many reasons. And they're so specific on how to do them that I can do it, that people can learn how to do it, but it's not rote, it's not mechanical. Like there's something about it that's transformative when you're actually doing it, that creates this amazing connection. And I think that team for me is personal. Like it is me. Like I can't even separate anymore, like work, personality versus private personality. I'm using them pretty similar.
Yeah, I absolutely love and can relate to what you're saying, Angela. And I think that what makes it so is the authenticity part. Is that if you try to just do and follow the steps, you're not really bringing who you are into it. But the process is calling for you to bring who you truly are into it, and that what makes it so impactful.
Yeah, I love what you're saying. The process requires you to bring yourself as you are, like that, bring it into the mix. I know I originally was hoping for like really cookie cutter, like, well, what do you say of this? What do you say of that? And David's like, no, you're not getting it. and I wasn't getting it. And now that I'm getting it, I realize, oh yes, that's why we can't have a formula. It's a structure, but not a formula. And that's not always easy to explain until you dive in and see it for yourself. But we're actually running out of time. So our last question that we always ask everyone who comes to the podcast, the vlog is, if every therapist in the world, if every psychologist in the world were listening right now, what's one thing about TEAM you'd like them to know?
I think I want to know that it's a lot of work, but it's totally worth the effort. Every little bit of it. It's can you imagine, it's not everybody's cup of tea. But and actually maybe not to be discouraging that it's a lot of work. It's intriguing, right? It's if you like learning, it's probably for you. If you like trying to teach yourself to think outside the box, if you want to think outside the box, it's probably for you. If you like working with, people who would not just sugarcoat things for you, but will tell you how you can improve yourself, then it's probably for you. And so there's a lot of advantages to it. And just like Dr. Burns tells us, it's like learning a piano. The more you practice, the better you get at it. TEAM is exactly the same thing. Like the more you do it, the better you get at it. But I think the more you do it, the more you love it.
Yeah, that's true for me. The more I do it, the more I love it. And I keep, getting my fingers in all kinds of pies because it's so much fun. Thank you so much for joining us today, Dr.
Thank you, Angela.
Thank you. Thank you to all our listeners and viewers. Bye-bye.